how effective have you seen some of these treatments being?
I think they're very effective because even starting with babies, when they start showing signs of bronchiolitis or reactive airway disease, which is a precursor of asthma, when I start switching their diet and start adding a few supplements in their diet, it seems like I don't have to use as many asthma medications of them anymore. None of my asthmatics even need to go to a specialist, like a pulmonologist and stuff. I seem to be able to manage their asthma very good. They hardly have any ER visits to the emergency rooms, or they don't ever have any hospitalizations. So I think it's a very good, sure way of treating asthma.
You had mentioned things like apples.
Yes.
And I was wondering, how can nutrition and exercise help in managing asthma?
I'm sorry, the question was how can a nutritionist help in managing asthma?
Well, I was wondering, certainly we've heard about the comorbidity question with asthma and obesity. And I was wondering, from your perspective, how can nutrition and exercise help in managing asthma?
Well, the newer study that they showed did show that asthma and obesity was linked. So getting the kids to lose weight would be the first thing to avoid asthma. And the second thing is diet has a very big issue on allergies. Because even if we test kids, lots of kids here get tested for food allergies and they come back negative for so many things. But even then we start doing the elimination diet and we see a lot of changes, like visible changes in their symptoms and the way they manifest and how frequently they get sick. So even if they're not allergic to things, there's something called food sensitivities that they seem to be showing a lot. And changing their diet, removing, like I said, the first part, like remove the allergens and the food sensitivities, that is mostly like all the processed food. If you actually get all the processed food with all the chemicals, all these pesticides out of their diet, the first thing would be to remove the allergens. Second is you're reducing calories. That itself would try to help bring obesity down. So it's it helps both ways. It helps kids reduce their allergies and asthma and bring down their weight, which again on the hand even helps decrease the asthma.